Sickle cell anemia is a genetic disorder. It is autosomal recessive, which means both parents must be carriers of the trait for a child to get it. The name is pretty self-explanatory in and of itself. Your red blood cells become sickled shaped, therefore making it difficult for blood to pump correctly or flow, thus causing serious blood clots and extreme pain for those who have the disease. There are 6 types of sickle cell disease, but today we'll be focusing on the homozygous form, hemoglobin SS, which is the most common, otherwise known as sickle cell anemia. The body does try to put up a fight against sickle cell anemia, but sometimes it can be just unhelpful because it may attack some of the sickle cells knowing they're no good, but it may in the process also attack healthy red blood cells, thus adding to the fatigue. Though there's no way to predict when the body will have a crisis, you can surely take precautions by taking notice to a couple of signs, such as if you can suddenly develop a fever or a body part is starting to swell uncontrollably or swell at all. You should go ahead as a sickle cell anemia patient, take yourself to the hospital or have someone take you to the hospital actually, because these symptoms could just be normal, but there's no reason to take that risk with the disease that you have. When an extreme blood clot forms in a sickle cell patient, it is referred to as a crisis, which is an extremely painful blood clot and is very abrupt and can very much slow down a person's day and how they want to act for the rest of the day. The sickle cell anemia is not limited to, but is mostly found in Africa, the Caribbean, South America, pockets of the Middle East, and Southern Europe. As some of you may have previous knowledge to, sickle cell anemia is much more common in African Americans. It is understood that approximately 100,000 Americans suffer from sickle cell anemia, 1 in every 365 being African Americans suffer from the disease, every 1 in 1,600 Latinos suffer from the disease, but in African Americans, every 1 in 12 is a carrier. Thus, they can pass on the trait, or if their partner is also a carrier of the trait, they could easily pass on the disease to their children. As well as blood flow blockage, sickle cell anemia can also cause problems in other areas where it can impair your ability to hear, see, think, and speak. These are usually brought out during the moment of crises where it'll be sudden and a person will be disoriented and you can know, and then it'd be time to go to the hospital. Though it can be easy to just accept defeat and be upset, a lot of sickle cell anemia patients won't allow it to be their crutch. They'll go on living their lives as they want to. For example,
I came to St. Jude when I was around 5 years old. Growing up with sickle cell, it was really different for me. I couldn't do what other kids did, like go outside. It was a struggle, but I came to see that if I didn't have sickle cell, I probably wouldn't be like the person I am. I don't want sickle cell to define who I am. I don't want that to be a factor like, oh, she has sickle cell, or she can't do that. Just because I have sickle cell, it doesn't mean I can't do anything.
As awful as crises are already having to do with, sickle cell anemia patients also have to do with the struggle of possible liver damage, jaundice, which is the yellowing of skin and eyes, dehydration at a sudden moment, even while being active and playing sports. But as Mike can show you, you don't have to let that stop you from doing all active activities. You just have to be careful on how you act and choose when to be active.
Hi, my name is Mike. I'm 18 and I have sickle cell disease. I like to skateboard, play guitar, rap, draw, play games and all, just hang with my friends. I experience pain most in my lower back and my jaw gets some throbbing, and that's how I know it's not just like a cramp or something, it's sickle cell. Me and my parents, we use the number scale 1 through 10. Anything from 0 to 3, I'm still able to do everything I need to, even sometimes skate. 4 or above. That's when I'm usually like, nah, I don't feel like doing this. If it gets any higher, then yeah, I'll probably just stay in the bed.
Sadly, the list of symptoms of sickle cell anemia goes on, some being priapism, which is in a long direction that can lead to impotence, which is, simply put, infertility and the inability to have kids. Another being meningitis, which, since sickle cell anemia makes you more susceptible to infections, it can lead to the swelling of many body parts, which does not exclude the spinal cord, which would then lead to this disease, a side effect, meningitis, which leads to severe headaches and stiffness in the neck. Also, as you would expect, since blood flow is an issue with this disease, it could take away from your brain, which could then lead to strokes. The number one cause of death from sickle cell anemia is referred to as acute chest syndrome, which is the body being unable to carry as much oxygen through the red blood cells since they are sickle shaped. This causes extreme stress upon the lungs. Repeated acts of this can cause lung deterioration, which can cause the lungs to fill up with liquid, or ultimately they can cause death. Since this is the case, it usually leads to an overnight stay or multiple nights spent in the hospital, and can be treated with lots of medicine, watching the fluids you take in, and blood transfusions, as well as just giving the patient oxygen through a tube. While on the topic of going to the hospital, pregnancy is not impossible, but it can be an extreme strain on the mother and the child if the mother has sickle cell anemia. The baby inside will need blood flow, nutrients to their body, but sickle cell anemia literally prevents this. So when the baby is born, it could either be a stillbirth, or if they are born, it can lead to complications in growth, stunted growth, and the mother can also then be hospitalized for sometimes overnight, or hospitalized for multiple nights, needing blood transfusions and round the clock care to make sure she's okay to go home. Another serious condition is a heart murmur, which is a valve in your heart is being overworked or feeling the need that it needs to disperse blood quicker, which can cause your heart to overwork and pump out too much blood and can cause cardiac arrest. As expected, as you get older, the disease is harder to deal with as your body isn't as willing to fight, or not even as willing, as strong as it once was when you were younger. You're not able to bounce back from the pain, and it's also a mental wear on you dealing with this disease. Though there is no cure for sickle cell anemia, not all hope is lost. There are some treatments that can better help a patient cope with the pain and have as little crises as possible, thus making it much easier to deal with. Some examples would be hydroxyurea. This is a medicine that is usually advised for people that have a very severe crises, or 3 severe crises within a year. It's also bone marrow transplant, so the body can then produce more non-sickle shaped blood cells from a donor that would not have sickle cell anemia, obviously, or just simply get a blood transfusion of someone who is compatible with their blood type, who, as you would expect, does not have sickle cell anemia. Though those treatments can help on a bigger scale, on a at home type of level, you can just make sure you drink a lot of water, take care of yourself by having a good diet, getting a reasonable amount of exercise, nothing too strenuous to get too much blood flowing, and just regular checkups to go see your doctor and make sure everything's in order. That concludes our project, and thank you for watching.